everyone, this is Drake Behrakis, Chair of the National Hellenic Society, and it's my pleasure to bring you to another one of our NHS Talks Excellence series. And with us today is Dr. Elisa Konofagou from Columbia University. Elisa, welcome.
Thank you. Thanks for having me.
My pleasure. Our pleasure to have you. We're always excited to showcase young professional Hellenes of all over the world and some of the tremendous work they've done. And so certainly you've definitely fit that criteria. And I'm going to start off right with a bang before we get into your background and how your journey started. This past fall, you were elected to the National Academy of Medicine. Which is obviously extremely prestigious, one of the highest honors. It's an outstanding achievement. So first of all, congratulations. Tell us a little bit about that. I know this is, we hear about the National Academy of Medicine. We know, obviously some of the popular names of people that are on it, like Jeffrey Sachs and Anthony Fauci, who everyone knows today, and of course, Ben Carson. So tell us a little bit about, what the Academy is and how you were elected, and what the expectations are for those of us that are not familiar with what's expected of you now that you've joined the Academy.
Yes, thank you first of all for having me. It's a pleasure to be here. So the Academy it came completely unexpected. I'm an engineer, and it's always surprising to me to see that actually medical doctors and clinicians and physicians out there are appreciating the work by us engineers. So that was a real surprise. I mean, the way that it's done in national academies in general is that you don't know you're being nominated. It's a very, hush-hush on purpose. They tell us now, and I see that from behind the scenes. And the first thing they tell you when you have your first meeting after becoming a member, they say congratulations, like you just did, and they say now you have to serve, and you have to bring new members, and you have to nominate. But the members cannot know that you nominated them, and you cannot campaign, or they cannot campaign for becoming members. So it's on purpose, and they're trying to basically make sure that it's merit and only merit based. We have a responsibility to make sure that we're involved in anything, obviously, from a COVID crisis to informing the community, to making sure that the knowledge is communicated properly, the medical knowledge, and you belong to a group that has similar expertise as yours. There's a lot of different sections. I think there are about 9 or 10 different sections according to expertise, like from nephrology to neurology, diseases, infectious diseases, and you meet as a group every other month. But so there's a lot of commitment on your time. But so there's definitely you definitely serve. You're trying to basically also nominate new members. Advanced members that are already there to specific votes for new leadership and all that stuff. So it's very, very involved, but I'm happy to be involved and obviously honored to be included.
Well, that's wonderful. It's obviously, like I said, it's a great achievement and accomplishment. You should be very proud, and we as Greeks in the diaspora are very proud as well. And we don't want to lose sight of the great work and accomplishment. So tell us, how did your journey begin? How did you tell us a little bit about your upbringing in Greece and your education, and I guess what kind of piqued your interest to first start looking at engineering and so forth? Was it something, are other family members scientists or doctors, or was this kind of on your own based on your own interests? So tell us a little bit about what got you going.
Sure. So I have I'm very, very lucky. I have a lot of members in my family that have PhDs, and some of them are in engineering. So my mom has a PhD in economics. My dad has a PhD in chemical engineering. My granddad had a PhD in mineral engineering. And I have an aunt who is a civil engineer. So you can imagine, no pressure.
No, you had very, very high bar to start, right?
Yeah, the upbringing is like, you bring these grades and go back and improve on them. This is So from that point of view, there was a lot of support. So science and engineering was in our household the whole time, and you were expected to know your stuff. At the same time, the bar was high to achieve and to take it a step further. My mom always wanted to be a professor. She didn't get to make her dream come true, unfortunately. So of course, you pass on to your kids what you didn't get to do. And she instilled in me a passion of academics in general, and how pursuing a higher degree is really the way to be able to advance science. I mean, I saw her as a 13-year-old graduating with her PhD because she could not do it earlier. She had to wait until her 40s to graduate with her PhD because she had two kids. And I saw that we went to the graduation together, and that was, as a 13-year-old, you're like, wow, it's that's what it takes. So that also, the fact that you see balancing family and research studies and doctoral studies, that was also a good learning experience on my side.
Wonderful, wonderful. And so what that led your journey to first, I guess, to outside of Greece to Europe, and then eventually the US. So tell us about that.
So the US came into my life early on. So I actually, all my, like adolescent and of course childhood was spent in Greece. I grew up in Athens, in a suburb of Athens called Agia Paraskevi, which is in the north part of Athens. And very simple upbringing and childhood. I was first in a private school, more 80s, and I was taking the school bus every morning to go to another suburb, Psychiko. And then I switched to public school, a model public school called Karvakio, which was also in Psychiko, also going back and forth with the school bus. So very, simple upbringing in Greece. But then my mom got an Onassis scholarship, to go to Harvard for 3 months in the summer and finish her PhD at the time, finish some of her research she was doing on financial economics. And then she took me and my brother. I was 12 at the time. I went for the first time to the US in Boston, actually, where you are. That was in '84, and I remember vividly, going from Athens to Boston, and of course my first time out, outside the US. I mean, outside Greece, going to a brand new country, and going to the US, which is like you see it in movies. I had just, I think, seen the ET, the extraterrestrial.
Sure.
That's what I knew about the US, people flying on bikes. But anyway, so that was really, really, for me, immersive. We went to a summer camp, which at the time in Greece I had gone to camps, but it wasn't so organized with baseball that I never played before, basketball, but also some science part. And I really enjoyed those 3 months in the US. And then after I came back, I said, okay, I want to go back to the US at some point in my life. I really want to go back to the US. The other thing that happened is my mom knew that I was interested in engineering. And at the time, I was interested in mechanical engineering. So we visited MIT and we met with Professor Simeonidis there, who was in mechanical engineering. And that was actually the start of me, understanding Greek diaspora and how they really make their time, the time to meet with people who are just coming from Greece and to educate them and mentor them. And he showed me the bulletin at the time. Obviously, there was no internet. And he said, yeah, this is what we offer in mechanical engineering, but you should see also other disciplines. And at that time, I remember vividly, like it was yesterday, biomedical engineering. I've never seen that before. In Greece, it was mechanical, electrical, civil, some computer engineering was starting back then. And that was it, basically. So I was like, wow, this is because I was interested in medicine too, but not become a medical doctor. I was just intrigued by medicine. And I was like, that's what I want to do. And I was 12. I was 12 at the time. Then I come back to Greece, and long story short, it was difficult to find biomedical engineering in Greece. It hadn't started there. And I liked physics and math. Those were my favorite subjects, and I still do like them. But again, I wanted to do something, not necessarily the pure engineering, but something along the line of biology and medicine. that was not available in Greece at the time. And then because a lot of my family members, including my dad and my mom, and also my granddad on my father's side, had studied in Paris, I applied there with my grades, and there was a biophysics um, degree that you could get there that I thought at the time it blends physics with biology, which was what I wanted to do. After that, after I went to the Université of Pierre Marie Curie, the Paris 6, I wanted to do something more in engineering. So I really loved what I did for my undergrad. And then at the time, Imperial College in London had just started a program in biomedical engineering, a master's program. So I think it was the second year. And I couldn't wait to apply. And luckily I was admitted. And the rest is, for me, history. I never look back. I'm still in biomedical engineering, and I'm still doing ultrasound. That started basically in that master's program.
And then you eventually made it to the US for your PhD.
Oh, yeah.
Yes.
And then eventually I made it to the US for a PhD. I didn't get that. Thank you. So I graduated from a master's in Imperial College, and then I took a gap year in Greece. I did research in the Onassis Cardiac Surgery Center in cardiac cardiology and cardiac imaging, and then in the process, I was doing cardiac imaging for my master's, ultrasound cardiac imaging. That was very, very. I was very involved with the cardiologist in St. Mary's Hospital in London, and then I wanted to take that work also in Onassis Cardiac Surgery Center. I collaborated with cardiologists there too, so that was kind of my calling. Then I started to think what I want to do in the US, and what biomedical engineering program I could get into, because as you know, as an international student, it's much harder to get into PhD programs in the US. And Behrakis, who was an electrical engineer at the University of Houston, said, "You're interested in ultrasound, and there is a person here, a professor, who is doing ultrasound imaging, not of the heart, but of the breast, and is looking for students. Are you interested?" I'm sorry. Yes, I'm very interested. And then long story short, I did apply there. I got admitted, and I started doing my PhD at the University of Texas Medical School, while earning my degree at the University of Houston in biomedical engineering. So that was my first landing in the US in Houston in November, and I remember wearing a sweater because in Greece it was cold. Arriving in Houston, it was humid and warm, and I was like, "What is this climate?"
So it's good. I mean, obviously, you had the opportunity because you're obviously an excellent student. You were very dedicated to your work. You achieved along the way. You had a great support network in your family, as well as kind of, I guess, obviously your mother and father are very important figures in your life, but as we all know, our mothers and fathers also can be our mentors and our heroes as well. So they help guide you, but it's also great to hear, and of course, I think a lot of us hear it here in the States because we're part of it. But it's nice to see along the way that that there are other fellow Greeks that are helping you open doors and look at opportunities. So that's tremendous. That's, as you said, it's a challenge in the very least as an international student, trying to get an understanding of the landscape, but also where the opportunities are, and by having people already there in the system, so to speak, to help guide you and help open doors and be open to it, is obviously a great testament to how as Greeks we want to help each other, and especially here Greeks in the diaspora, when we see students or professionals come over to Greece, whether it's Boston, Houston, Chicago, New York, anywhere, that yes, you can always find somebody, which is how I guess how what a great accomplishment we have in ourselves, that we're very dominant in the science and medical fields and the engineering fields as well, but also playing key roles. And that's a lot of times people that reach prestigious levels, you always wonder whether they truly are there to give back and help I mean, they've earned their accomplishments, but at the same time, doing the little things like helping students like yourself. And it started at MIT during a summer program where it piqued your interest, and then in Houston in Texas. And so it's wonderful to hear that network is alive and well here in the States. And I think for my generation, I'm second generation Greek American. I try to do as much as I can in my role, because I've seen how my father helped others here in this, not only just here in the Boston area, but others in the States, and folks coming from Greece. So it's great that we have, one of the things we always hear about the negative stigma of us as Greeks, where it's, we're very jealous of each other. It's the competition, the zelia, as I said, and so, but it's at the end of the day, our hearts are in the right place, and it's great that there are people out there that are there to help. And let me jump before we get into obviously your postdoc here in Boston. One of the things I was going to ask you, which we spoke about via email, is typically, and at least here in the States, and I'm sure you experience it as well in Greece and in Europe, is traditional engineering fields have always been men dominated, male dominated fields, and of course there's been tremendous progress with more and more women entering the field and also being accomplished in the field, and we see that in when you get into the bio side of it, or the medical field as well. So it's great that you had a mother that was kind of a pioneer, so to speak. But at the same time, as you've gone through your journey, making it here to the States, and now that you're at Columbia, what was that transition? Because you not only were obviously a woman entering the field, but you were an international student as well. And so, how was it? How was that kind of that transition? Did you? And you're probably at the forefront, because I think nowadays the biomedical field, as we all know, especially here in Boston, is has grown tremendously. Um, and so, how has that, as kind of I guess an early student of that field, how have you seen I guess the role of woman change, and more women become involved? Is it become less of a kind of the male stigma, so to speak, and tell us a little bit about that part of the journey.
Oh, I love this part. By the way, it really speaks to my heart. Um, I, it's funny. I've been basically in academia for about 30 years, and it has changed tremendously. So as a student, for my undergrad, for my master's, for my PhD, I only had one female professor, only one, and over the course of 10 years, and in chemistry, actually. And I remember she was like an exotic bird. Like, wow, because she was walked in class every day. Look at that, and
Yeah.
a woman teaching us. At the time, I was not conscious of that. I was like, I just had this random thought, and I thought, okay, yeah, there are so many men, obviously, in engineering and sciences. I never really questioned it. Our generation, I feel, my generation at least, we weren't questioning a lot of things. That's maybe another topic for another discussion. But I feel like the generation now, the students that I see, they're very alert. They're very alert about who's around them, what are they talking about, and then whether we can advance this for more people, whether we can make it more egalitarian, right? The system. So for me, if it weren't for my mom, yes, my mom was one of my heroes. You're right. If it weren't for my grandmother and also my aunt, I wouldn't actually think it would be possible to say I will be an academic professor in engineering. But it was ingrained in me. I was seeing it every day, right? I mean, these very capable women, working mothers, and my mom was also a single mother, and it was like, okay, you can do it. I mean, the role models were there for me, right? But I can completely understand now when I talk to women who want to have a career in engineering and want to balance life with their careers, because it's very important. I think it's more important even now for female students than for male students. I mean, I say the joke sometimes, no male student has come to me saying, how do I balance family and yeah, and career, but a lot of female students from the beginning of my career as a professor, they would say, okay, you're doing this great research, but really, are you married? I mean, I think it's more important for us, I think, growing up, to have this normality in our lives, than maybe on the average, most, most men may not have this question in their head as much as women do. But there's many men that have that now as well. And I want to say that men are key. What I found throughout this journey, that men advancing women are the key to where we are now, right? Because if we didn't have male professors to say, you know what, you have something, you should pursue it. I'm going to help pursue it, and then it was very difficult. It's like anybody else who's a mentor. If you don't help your mentee, if you don't advise them to where to go next, how to network, where to apply, then this person is not that, they're going to perish. They're not going to be able to advance, especially in academia. So, and women need role models. I mean, we all need role models and heroes, but I think they want to see it. We want to see another woman do it. Why? Because there's no women doing as much at high places, positions as men. I mean, we take men are the default. So in order for women to believe in themselves and say, you know what, I could be a professor one day, I could be a CEO, or I could be whatever, president, you have to nurture that. It doesn't happen, it doesn't happen out of nowhere. So that's basically what I think a lot of, in my case, there was a lot of luck, from the point of view that I had a lot of good mentors around me, men and women, who will say, who will mentor. Was there competition in academia like everywhere else? Absolutely. Is everybody going to nurture you like some people may think in life? No. And I say this also to my students, when, I want to challenge you and I want to also help you. But when you go out there, some people may only want to challenge you and never help. So you have to be tenacious. You have to believe in yourself. You have to have somebody instill confidence in you. Otherwise, and nobody's instilling confidence, if some people say you're never going to become an engineer because you're a woman, or you're never going to be a professor because you don't have it, then what I say to students, because some people have that in their lives, they have family who say, you know what, you need to get married at 25 and you need to have kids, and which is okay if you want to do that in your life. Absolutely. Right. I mean, I think the most difficult thing is having a family, by the way, and raising a family. But for the women and the men who want to have something else in their lives, their own careers, you need somebody to champion you, right? And if you don't have it in your family, you have it in your extended family. Or if you don't have it in your extended family, you look for your friends. And if you don't have it in your friends, you look for somebody out there, a mentor who can. There's always somebody who will kind of see something in you and mentor you. I hope.
Well, and it sounds like you're doing just as much giving back as you were, as much as you've learned, and that you're mentoring young students as well, both male and female. But it's great that there is more female interest and more female involvement and more one woman taking on high level roles at all types of institutions. And let's jump to Boston. And again, I'm saying this because I not just because myself and my family have been involved at the Brigham and Women's Hospital for a number of years, but realizing and understanding is one of the top not only cities in the world, medical centers in the world, and having the Harvard affiliation, that this is not an easy place to get into. Yet day in and day out, there are so many Greek and Greek Americans and Greeks from all over the world that find their way to Boston and are central to a lot of different areas. And you speak about competition, global competition to get these spots, and so you obviously, your record speaks for itself. You earned a postdoc position here at Brigham and Women's, and so tell us a little bit about that experience.
Okay, so Boston was dear to my heart, right? Since 12 years old. Now, I didn't make it the way that I thought I was going to make it right, right back. I took my time to get to Boston, and it was, yeah, it was an eye-opening experience for me. I mean, Houston, Texas in general, it's very dear to my heart too, because I learned a lot of the research approach that I'm using even now today. I mean, I hear my research advisor, Jonathan Ophir, uh, in my ear, and like we do with our good coaches and mentors. And so you know that your training there was good. But when I went to Boston, especially Brigham and Women's, the people there that are passionate for the research and they're willing to spend time with you to figure out things, to sit down with you, to put together a tool that can change medicine one day. Um, it was incredible to see that. I had actually, meetings with the chair of radiology. I was a postdoctoral fellow, like who? I mean, I wasn't even. I was a PhD. I was not an MD, and then he will make time for me, and then I will apply for fellowships. I will get them. He will write all these recommendation letters, and so from the scientific and the support, like the value in research. Like if you want to do research, you have to go to a place where they're not just looking at a patient as a customer. They're looking at a patient as a human being, and they're trying to basically figure out why did I miss a diagnosis? Why does the treatment didn't work? And what can I do? Who is around me as a scientist or an engineer who can figure out better the disease, figure out the tools that I need to put in my hands to actually do this better for the next person. So that's what Brigham and Women's is to me. This is what I learned there, and how cardiologists, radiologists, oncologists, you name it, will take out the time from the very busy time from their patients and their own research groups, and be able to figure things out together. And we have publications and papers there together. And then when I came to Columbia, I knew how that model worked, and how I knew that for sure that I needed medical, collaborations, clinical collaborations. And when I got to Columbia, you have the choice. It's similar to MIT and Harvard. I mean, they're apart. There's two campuses. They're about 15 minutes apart. So Harvard Medical School, I mean. So Harvard Med, as we know, is in Boston, and then MIT is in Cambridge. And Columbia is kind of has the engineering equivalent in one area, Morningside Heights in Manhattan. And then you have where I am right now, which is the medical center in Washington Heights. And that's about 15 to 20 minute ride on the subway. So uh, I was asked when I was hired at Columbia, where do you want your lab to be? On the engineering campus or on the medical campus? And I said the medical campus, because I wanted to have this in feedback and input from clinicians, and I knew clinicians will never get to the engineering campus, because why would they go there?
Right.
And the patients, we need to actually program our scanners, take them to the patients, make measurements, and we do them to this day. Last week we're doing a breast cancer patient on the table. We're developing new technology to basically be able to in situ, without an incision, treat their tumors. But that's what's happening like 5 minutes from our lab. So we can program our scanners, program our equipment, and then wheel it literally to the bedside, patient's bedside. So that model I learned from Boston, the way that you can interact with patients, and I have benefited a lot by the clinicians here who are top tier, obviously, and top in the world in their field.
And you were at a point too. I mean, correct me if I'm wrong, but again, I'm not. I don't have a science background, but I'm obviously involved in the field on the periphery, so to speak, where you're very deep into it. This last decade, the cross collaboration, as you said, between engineering and medicine has really exploded. And you see that obviously we see it every day here in Boston with the new research centers that have been set up, whether it's the Broad Institute or what the other hospitals are doing. Um, and these research centers are bringing in again the non-traditional people that you expect. It's not just traditional pharmaceutical companies anymore. They're involved heavily, but they're obviously investing in this technology and investing in the engineering field to assist them. And now you even see major companies like the Amazons and the Googles that are investing heavily in helping facilitate this cross collaboration and moving that forward. And you've experienced that firsthand, as you said. When you were in Greece, the biomedical really didn't exist. It was slowly starting in Europe. It was advancing here in the U.S. and you jumped right into it. And it must be fascinating. We're all, we can't choose when we're born, correct? And we can't choose when we're going to die. But certainly, to be part of that wave must be exciting for you personally, because you've been able to experience it and you're still experiencing it, but you're also a major player in it. I mean, let's be realistic. I mean, the accomplishments you've had in a short amount of time are extraordinary. And going again from starting off in Greece to going to Europe, coming here in the States, getting your PhD. If that wasn't enough, getting a postdoc in Brigham, and if that wasn't enough, going to Columbia. And now it's come, and I don't want to say full circle because you're still young, you're still very active, and now you're were elected to the National Academy. So it's really remarkable. And you're very modest, and I appreciate that. It's but obviously you've worked hard to get to this point. And it must be, I can only imagine it must be exciting every day for you to get up and go into, whether it's class or go into the lab and just see how the field constantly is changing, and you're playing a major part of it, not only as an educator, but as a scientist, as a mentor yourself. And so congratulations. You've done, I know we really haven't talked too much about the work you're doing. So I guess maybe we can close on that a little bit, and tell us a little bit about kind of the trajectory of, you mentioned you started off in ultrasound and so forth, and tell us maybe some of the exciting things you're working on now.
First of all, thank you for your kind words. I mean, I have to say, I don't think I'm doing more than the average person. But all I'm trying to do is basically, my kids ask me, why are we here? And I'm like, I don't really know, but at least, trying to make the world a little bit better than what we found, how we found it, right? So I think that's what I'm trying to do. I'm trying to make, in this case, put the tools in the, physician's hands to make the patient's lives better, right? So what we're working on, the exciting things that we're working on, all of them are exciting, and I have a tremendous group of students and postdocs in my lab that I'm thankful every day that they're here, and Columbia really is nurturing that. So we work with ultrasound, but we work with both the imaging aspect, diagnostic aspects, but also therapeutic aspects. So ultrasound is known a lot about, imaging babies in utero. So for layman, but it's used a lot also for cancer diagnosis, for heart diagnosis, also on a daily basis. We're trying to quantify a little bit better these images, because a lot of that is heuristic. Is I found something on this image, I'm not sure. We're trying to quantify how the tumor is progressing, for example, if we found one, and how it responds to the treatment. So that's something that we're doing through what we call elastography or elasticity imaging, which is imaging the mechanical properties of tissue, how elastic it is, how soft or how hard. That can tell you a lot about the response of the tissue to the treatment, and also how the tumor is progressing. In the heart, very similar. The mechanical properties, not of the tumor in that case, but also the heart hardens in the case of disease. Coronary artery disease is one, obviously the number one killer in the US. And the heart doesn't have enough oxygenated supply, doesn't have enough blood to pump, and it becomes harder. It's almost like having a cramp, for example, if you're lifting weights. And that, of course, can lead to fatal events. the idea is to catch that early, to image it earlier and treat it early. Early diagnosis is key there. We also do electrical analysis of the heart, so whether an arrhythmia is treated properly, either with drugs or with ablation. So that's something that we have developed. We call it electromechanical wave imaging, which basically can see how hard your is charged at every heartbeat. This is something that's not doesn't exist right now in the clinic, but we hope to have it in the clinic soon. On the therapeutic side, we're trying to do a lot in the brain. The brain is the last frontier when it comes to treatment. It's very, very heavily sealed off from the rest of the circulation for obvious reasons, because obviously it controls a lot of our organs in the body. And if it something goes wrong with it, other organs go wrong. And also we have fatal events as well there. So we work on Alzheimer's and Parkinson's disease treatment mainly. We also do some pediatric tumor treatment, so opening the blood-brain barrier to get the drugs that normally do not penetrate. So but the barrier is a filter in our brain that filters out very well toxic particles, but unfortunately it also filters very well drugs that treat it. So we temporarily open it, and we hope to make a difference, especially in neurodegenerative disease and cancer. And then the last part is on treatment of cancer, especially in the breast. With early diagnosis, breast cancer has come a long way, by the way, over the past couple of decades. The drugs are incredible, and if found early, can be treated early. But we also work on benign tumors, which are not necessarily going to be devastating to the patient because they're benign, but they keep growing and they cause discomfort. And you still have to have surgery after a while because it has become very uncomfortable. So we're trying to develop a technique that will basically stop the tumor growth without an incision, as I mentioned to you earlier. And the other aspect is also similar methodology of assessing whether chemotherapy works in the first week, as opposed to waiting until the treatment is over, and then potentially switch drugs if it doesn't work properly. And then finally, using the same therapeutic aspect of ultrasound of burning tissue in a localized millimeter-sized region, also with that incision for malignancy.
That's fascinating. I mean, I'm always, as I said, my father has a science background. I was interested in science, but I chose to stay in more of a business career, financial career. But I've always been, through not only his journey, but also knowing how important it is, and obviously being fortunate enough to be in Boston just to see how transformational it is. And the work that's being done on every single day in our medical systems is fascinating and tremendous. I was going to ask you one more final thought before we get off the phone or get off the Zoom call. Is there's been a lot in the last year in the news with regards to the Greek government opening up the public universities and research centers in Greece to have more collaborations with counterparts here in the States. And that was one of the first major initiatives of the New Democracy government a few years ago. When they came over here, the Minister of Education was here as well. And so I know there's been a lot of discussion, and there's been some things published and some things that have obviously come out in the news. And I know Colombia is one area that they've they have have had a lot of discussions with. Have you seen anything at your level? I mean, obviously this is all positive news, but anything with regards to the areas that you're working in? Do you see any of that from your vantage point in terms of working with peers across the ocean into Greece, or is it still kind of high level at the higher levels, I guess, of universities like Columbia?
So I'm very happy you asked me that question, because there's a lot going on, and I think since this government came to power in Greece over the past 2.5 years now, it has been they're very interested in science and research in general. How do we make sure that we put Greece on the map when it comes to scientific research? I'm part of the committee which is called ESETEC, that brings different people from different disciplines, experts from different disciplines, and we put our heads together every 2 weeks over Zoom, from people from Greece and people from outside Greece, from Europe and the US, and we try to basically see how we can how we can change things from within, by advancing anything from funding agencies or task forces in different disciplines, from physics and math to chemistry to engineering to agriculture, and be able to utilize talents from all over the world that could help you know organize things better in Greece. Now, I am also involved now. The newest thing, which you're probably going to be the first to hear, that is that there is an agreement that was signed last July between the State Department and the Greek government to try to now fund entities in Greece and the US to work together. And that will be on the academic side, but maybe also on the startup side. So, so we're going to launch the program hopefully sometime in the summer. It's still being, we just formed a committee, a task force committee, and we're going to be talking to the embassy in DC, and also on the side of the Greek government. We're going to talk about to the Ministry of Education and the Ministry of Anaptixis, I don't remember how, development in Greece, and then be able to put something together that US cost matches the funding from Greece. At Columbia, we actually have now a program with NTUA, the National Technical University of Athens, Metrovia, where it's funded by the Behrakis Foundation in Greece to bring 3 students in electrical and biomedical engineering and have them study in take classes, but also study in research labs here at Columbia. And of course, there's a bigger, this can grow from there for all engineering disciplines with NTUA and Columbia. And there's an umbrella agreement now that has been signed by the provost of Columbia University. And we hope to actually do this across the US, follow that model of student exchange, so that the students go back to Greece and then hopefully, continue with that scientific research training that they got in the US.
Right. And it's a great first step, and I'm glad it's happening, and I'm glad, major universities here in the States are part of it.
Yes.
We know the talent is there, and we know the willingness and drive of the students is there. I mean, again, you don't have to go anywhere in this country to see examples like yourself, and students and professors and postdocs everywhere that are coming over from Greece and are in high demand, which is tremendous. And so to be able to go back, even though Greece is a relatively small country, but it has a lot to offer, as we know, and it's offered a lot to this world for centuries and thousands of years, and we continue to find new ways to give back. And so it's always great for us to have that perspective and understanding that we continue to give back to society. So I just wanted to, again, thank you very much, Elisa, for joining us today and for allowing us to hear your story. And obviously, a special thanks to our dear friend Stelios Papadopoulos for introducing you to us. Again, your work speaks volumes for itself. You've accomplished a lot in your life. Like you said, you're not just an educator, a researcher, a scientist. You're also a wife and a mother, and you've got a strong family connection, and you've proven to many women, which is a tremendous a gift in and of itself, to prove that that the work that women can do in this field, the sky's the limit. And if it wasn't for folks like yourself opening new doors for that next generation, we're proud to see things like this happening. So thank you very much. Thank you for spending time with us.
Thanks for having me. Thank you.